Dr. Douglas Robinson, Campbell Podiatry. I'm going to show you how I take care of a type of an ingrown nail that's called a pincer, P-I-N-C-E-R nail. A pincer nail is more severe than your standard ingrown nail. So a pincer nail almost looks like a teepee like this. So it's really digging into the side. This is like a straight view of the toe this way, and these are the edges that are really painful. The patient I'm going to show you has it on both sides, but one side is worse. So that's what a pincer nail is. This is a standard ingrown nail where it's just digging into the side. It's cutting into the flesh and will cause the ungual which is the side of where the nail grows into, excess. This is even more severe. So if it's like infected, this will get even thicker and thicker. So we've got to dig this out. So that's what we're going to do on this person. We're going to do it on the lateral border, although it's on both sides. We're just going to do one side. And many times when you have one side done, the other side doesn't hurt so bad. I prefer to do one side at a time, let it fully heal, and then 2-3 months later I can do the other side, because if I did them both at the same time, sometimes you end up with a very skinny nail permanently, or the whole nail will slough off because you're loosening up too much of the nail at one time. So this is called a partial matrixectomy. Partial means just the edge. I'm going to remove that straight back. I'll use a chemical at the base here to prevent that from growing back in. And this is a permanent correction with a success rate of about 85%. Sometimes it grows back and we've got to redo it. Sometimes it doesn't look good and we have to do other things for it. So that's what we're going to do for this person. This person's already been anesthetized, so this should be a completely pain-free experience. And I'm just going to show you the steps that I do to get this to be taken care of. So this is an in-office procedure. I'm just going to loosen up the ungual from the nail plate. You can even see how much this is digging in on the side. And when I take out the nail, you'll be amazed at how much is buried that you can't see because the skin is covering that up. So most people, when I do this, like they're gobsmacked. Like, oh, that was inside there? Well, no wonder it hurts. It's like taking the needle out of the lion's paw. There's no cutting of the skin. There's no suturing that needs to be done for this. But there is home care that involves doing soaks every single day with some Epsom salts, and a little bit of polysporin and a Band-Aid every day. Usually it's about a 4-week process to get this to heal up. And this little ring here is called a tourniquet. I'm using that so that it doesn't bleed. We want to have a bloodless field when we're doing this procedure. So I'm just trimming this edge back. Again, anesthetized, so there's no pain at all. So here's the nail. And remember, this is the only part of the nail that you saw that I had colored. This is all buried inside the skin here. So as you see this cleft was all occupied by that nail. That's no good, man. Too much. So all this now is cleared of that hard nail, so her soft skin doesn't have anything to push on to cause that irritation or searing forces. And this is called curetting the edge, so I get some of the callus tissue out of there. So they have just a really great result with this. I'm going to take just a little bit more nail there. And now I'm preparing that edge for me to put this chemical that will cauterize the root, preventing that root from growing back in. And the root of the nail is located right down underneath this area here. So we'd like to have a bloodless field, so I'm just using these long Q-tips. And I'm going to protect the skin with an ointment so that when I put the surgical acid on there, it's not going to hurt the skin. So we do this for protection. And I'm just going to make sure this is really dry in here. So now we're ready. That is dry in there. Now this is the chemical, it's called phenol, it's also known as carbolic acid, and that's what's going to cauterize the root in this area. And I'm just going to trim the leading edge of this nail so the patient won't have to do this for a month or two. So now that we've applied the carbolic acid several times, the cauterization process is complete. And I'm just going to flush this with alcohol to neutralize that acid. And this person will need to do a soak every night for 10 minutes. Epsom salt's above the ankle. Whatever temperature you want is fine, but you do it for 10 minutes. And then put a little antibiotic ointment in, like Polysporin is my favorite, over the counter. And then you just put a Band-Aid over it. And I'm going to show you how we do a Band-Aid on a lesser toe so you don't have just a big bulky Band-Aid that feels obtrusive. Sometimes you want to wear a sandal for a couple days, and then once all the dressings are off, you just basically have to keep a Band-Aid over this and you get back into conventional roomy shoes. Usually no problem at all. And this is what we ultimately want to achieve, is we want happy patients, we want happy toes. Good. Now, on Band-Aids, you want a 1 inch by 3 inch flexible fabric Band-Aid. I recommend you cut it in half, and then basically just one Band-Aid. Put a little antibiotic ointment here and just put that right around the toe. This is when this comes off and you're just going to do the daily wound care. So that's how we take care of a pincer, ingrown, painful toenail. I'm Dr. Douglas Robinson. Please take care of yourself and each other.